Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Spinal anesthesia, and we're looking at the order of the block. So what comes first? First is the autonomic preganglionic sympathetic. So first is the autonomic preganglionic sympathetic. Next is there is temperature. Then comes pinprick. So there's temperature, then comes pinprick, then comes the pain, the touch, the pressure, as well as lastly the motor. So pain, touch, pressure and the motor. So next is the regression of blockade. So there's something known as a regression of the blockade. So regression of the blockade is nothing but there is recovery. So this follows the reverse order. So they follow something known as a reverse order. So reverse order means there is the motor function is first. So first is the motor function, then comes the touch, then comes the pinprick. So motor function, temperature, then the pinprick, then comes the cold sensation and the autonomic. Then comes the cold sensation, as well as lastly the autonomic. So there's motor function, there's temperature, there's pinprick, motor function, temperature, pinprick, cold sensation, as well as the autonomic. To learn and grow daily like this, please do subscribe.